Alright, my name is Josie. I'm going to be your nurse today. And we're going to do a head-to-toe assessment to see what's going on with you. The door is shut, so privacy has been provided for. Can you tell me your name and date of birth?
Amy Bankston, 4675.
Alright, and I'm checking that information against her wristband. And I'm going to wash my hands and clean the bell and the diaphragm of my stethoscope. And I'm going to assess her appearance, body build, speech, and mood. She is well-groomed and relaxed. Her speech is clear and understandable. She has an athletic build, and her mood is pleasant and attentive. And I'm going to assess that she understands person, place, time, and situation. So, what's your name again?
Amy Bankston.
Alright, what time is it?
About 5:30.
Alrighty. What are we doing?
I'm at the hospital with you, and you're going to do an assessment.
Okay, and you said we're at the hospital, so
Yes.
place.
Where?
Yeah. Alright, and we're going to start with the cardiac part of your body. The
Okay.
cardiac system of your body. So do you have a history of heart disease?
I don't.
Do you have any chest pain or tightness?
No.
Any shortness of breath?
No.
Awesome. So I'm going to start by inspecting the 5 cardiac areas on, here, move this way a little bit, on her chest. So we have the aortic, which is on the right sternal border in the second intercostal space. We have the pulmonic, which is on the left sternal border on in the second intercostal space. We have the Erb's point, which is on the third intercostal space on the left sternal border. Sternal border. Goodness gracious. We have the tricuspid, which is in the fifth intercostal space on the left sternal border, and we have the mitral, which is on the mid-clavicular line, fifth intercostal space. So I'm inspecting all of that, and I don't see any thrills or pulsations. No, any lifts or heaves. And then now I'm going to, first I'm going to palpate. So I have aortic, pulmonic, Erb's point, tricuspid and mitral. And the apical point, which is the same place as the mitral point, is palpable and regular. And then I'm going to auscultate with the diaphragm of my stethoscope. Do aortic, pulmonic, Erb's point, tricuspid, then mitral. All right. And then I heard S1 and S2, no S3 and S4. And then I'm going to use the bell side of my stethoscope and do aortic, pulmonic, Erb's point, tricuspid, mitral. And then for the, I heard no murmurs. And then for the apical pulse, I'm going to palpate and count for 60 seconds. All right, her apical pulse was regular and 82 beats per minute. All right, I think I'm done with the cardiac. Let's move on to the peripheral vascular system. So, have you had any swelling in your legs?
No.
Have you had any cramps or pain in your legs? Have you had any skin color changes in your body? Awesome. Okay, so first I'm going to have you lean back against your pillow, still in the frame, and tilt your head this way. Don't hold it up. Lean it back a little bit. Tilt your head that way, and then sit up fully. All right, there's no JVD noted. All right, come back and sit back over here. A little more this way. All right, awesome. Okay, so I'm going to palpate her carotid arteries on both sides one at a time. All right, both pulses were moderate and present and equal bilaterally. And then I'm going to auscultate for bruits using the bell side of my stethoscope one at a time. Oh, don't hold your breath, don't breathe. All right, there were no bruits noted. And now I'm going to feel different pulses throughout your body. Can you spread your arms for me? All right, so we have radial, ulnar, brachial, femoral is here, popliteal, posterior tibialis, and dorsalis pedis, or pedis, however you say it. Okay, and then I'm going to palpate and listen to your radial pulse for 30 seconds. All right, her radial pulse is 82 per minute. And also, when I palpated all of the different pulses throughout her body, they were all present, 2+, and equal bilaterally and regular. And now I'm going to assess her skin. Her skin is indicative of her racial background. Her temperature is warm and equal bilaterally. Her skin is not moist. There's a slight turgor, but as is expected. And texture is smooth. And now I'm going to assess capillary refill for all of her fingers and toes. Okay. All right, all of her capillaries refilled in 30 seconds or less, so it was very brisk. And then I'm going to use the back of my hands to assess temperature on her legs and make sure it's warm and even, and it is. And then I'm going to test for edema by pressing and holding for 5 seconds on her shins. Okay, on her ankles, and on the top of her feet. All right, no edema was noted. All right, I think we're done with the peripheral vascular. So now I'm going to ask you about your abdomen. Okay. When was your last bowel movement?
This morning.
Awesome. Do you have a history of abdominal surgeries or abdominal problems? No. Okay, and Do you experience nausea or vomiting?
No.
Awesome. All right, I'm gonna have you lay completely flat, and I'm going to remove the pillow, which is a requirement, so don't yell at me. Go back. No pillows for you. Okay, and then I'm going to listen to all 4 quadrants of her abdomen for bowel sounds. All right, you can sit back up. Vowel sounds were present in all 4 quadrants. And, excuse me. Now we're going to move on to the lungs. So, do you have a history of lung disease?
I do not.
Do you smoke, vape, or do pipes?
No.
I know, it's on the sheet. Do you have any shortness of breath?
No.
Okay. Awesome. And first I'm going to inspect her anterior upper chest for any intercostal bulges or retractions, and I don't see any. And I'm also going to make sure her chest is symmetrical. Thank you. Which it is. And then I'm going to, give me a second. I'm going to, oh yeah, thank you, sorry. I'm going to palpate for tenderness, tactile fremitus, crepitus, or symmetric vibrations. Sorry, there's a lot of like mouthful, you know. Okay, and then I'm going to auscultate in the zigzag pattern. I'm going to need you to take big breaths out of your mouth. Okay? Okay. And then, sorry, give me a second. You need to think about it. It's a lot. Okay. And then I'm gonna have you turn around to where your back is more facing the camera. I know it's kind of hard. Maybe I'll just adjust it a little bit. Okay. And yeah. And then I'm inspecting her back to make sure that the anterior and posterior ratio is 2 to 1. I'm noting that there are no intercostal bulges or retractions, and it is her shoulders are symmetrical, her back is symmetrical, her skin color is supportive of her racial background, and I think that's it. Okay, and then I'm going to also take her back as well. All right, I'm going to take deep breaths in and out of your mouth. Alright, so my findings from listening to her breathing was that everything was regular, unlabored, clear, nothing to be worried about. I'm going to assess, I'm going to make sure that her breathing is symmetrical, so I'm going to take a deep, can you see what I'm doing? Hold on. I don't know if they can see what. I'm going like this on her back. I don't know if you can see. So take a deep breath in. All right, and when she breathed in, my hands went like this symmetrically, so I know that's right. And I also counted her breaths for 30 seconds, and it was 12 per minute. Hold on. I do a quick run through in my head because if it's in the video, it's in the video. I need to think about anything that I might have missed. Oh, I forgot to palpate your posterior back. All right. So I'm going to palpate for tenderness, crepitus, tactile fremitus, I don't know if I'm saying that right, and symmetrical vibrations. Okay. I think I'm done.